Born of a desire to share information and foster hope, the National Pancreas Foundation started in Western Pennsylvania in 1997 and is the only foundation dedicated to patients who are suffering from all forms of pancreas disease, including cancer. Comprised of compassionate volunteers and healthcare professionals, NPF funds cutting-edge research, advocating for improved therapies, and providing support and education for patients, caregivers, and healthcare professionals. That courageous, optimistic desire to foster hope has produced 21 NPF chapters in the United States and funded $3.5 million for 92 groundbreaking research projects. NPF is now developing the only national patient registry for pancreatic diseases, as well as creating approved NPF centers to help guide patients for the best in multidisciplinary care and treatment throughout the country. Today, we'll visit the NPF volunteers, patients, and doctors who are leading research and treatment for pancreatic diseases.
My sister-in-law, Joan Bursick-Dawson, was diagnosed with pancreatic cancer at the young age of 38 when her two children were 3 and 2, her daughters. What was amazing in this day and age, when everything is available on the internet, is that in 1996, pancreatic cancer wasn't even on the radar screen. I just felt that somebody had to make a difference. Nobody else should have to go through what the Bursicks went through. And luck would have it that I met Jane Holt, and we decided that we were going to start the National Pancreas Foundation and be the one and only foundation that covers all diseases of the pancreas.
I came to be involved in the National Pancreas Foundation purely out of frustration for the lack of cure for the disease. As you know, pancreatic cancer affects over 45,000 people per year, and it's actually related to over 45,000 deaths per year.
When I was 24 years old, I was living in Dallas at the time, and I'd been going through about a 6-month period where I just really hadn't been feeling well. I'd been having some digestive issues, and I lost 10 pounds in a month for no real reason. So I went to my doctor, and they told me that it was probably just stress, because I was only 24 and it was in good shape. And but they did a CT scan because I'd lost weight, and so they did one just to be safe, and that's when they called me and told me that they found a mass in my pancreas, and they thought maybe it was just a cyst, and so I had an endoscopy and biopsy done a few weeks later, and received a call one night, and my doctor was out of town, so a nurse called me and explained to me that I had a solid pseudopapillary tumor in my pancreas with cancerous tissue. It was a little scary, to say the least, when I received that phone call, but I went and saw another doctor about a week later, and he explained to me that it was a very non-aggressive tumor, and that there was a 95% cure rate with surgery. So I felt extremely fortunate to be diagnosed with a tumor in my pancreas that actually had a great prognosis.
So, you know, I think one of the greatest things I think about the National Pancreas Foundation is that it's an organization that has a really kind of personal connection to these diseases. It's great to have organizations like NPF trying to find a cure, but also trying to support your patients.
So the NPF is a great institution where they are providing young investigators like myself with funding to help fund new and important work in not only the management of pancreatic cancer, but early detection strategies. And so the NPF has been heavily involved in funding our project in molecular testing in early detection of pancreatic cancer and its precursor lesions.
The NPF has a number of roles, both in pancreatic cancer and in non-malignant disease and pancreatitis. And they offer an incredible array of services. It's really been an amazing thing. The National Pancreas Foundation local chapter here has actually been one of the movers on the national level in terms of supporting grants. And they've also taken upon themselves to support local grants. We can't do this without the help. The National Pancreas Foundation cannot do this without the help of everybody who's here at the gala, as well as in supporting them in this mission or so. It's not an easy mission. We don't think it's going to happen quickly, but we have to make small, steady steps towards that ultimate goal of helping these patients.
There are many ways you can contribute to NPF. Support the Courage for a Cure Gala and other events. Direct financial donation. Volunteer your time. Go to www.pancreasfoundation.org for more information.